Health experts are now urging people to get vaccinated after Ontario's top doctor issued a warning about potential outbreaks of measles.
CP24's Eden Debeba joins us live with more on this. You're along Hospital Road this morning, Eden, and we have 2 cases in Peel region and also 2 in Toronto. So this is a growing concern.
Oh, that's right, Jen. In fact, there's actually 4 active cases across the country, 1 in Peel region, the other in Toronto, both of them having to do with children who traveled abroad and only got symptoms when they came back home. It can take up to 3 weeks to actually see measles symptoms present themselves in either a fever, a rash. We also know people can get a runny nose, a cough, a lot of common symptoms, which can make it hard to diagnose if a doctor isn't involved in the process. And this really is the crux of the situation that the top doctor is warning people about. Make sure your children are vaccinated. We saw a big drop in measles vaccinations over the course of the pandemic, with children not going to schools anymore, a lot of strain on the healthcare system. But doctors are warning that if we do not see a rise in vaccinations and more measles cases present themselves, it could cause even more strain on our already fractured healthcare system. We spoke to experts to get a better idea of how measles is so contagious and advice for parents on how to protect their children. Take a listen.
Now, the number in Canada, as you mentioned, as Dr. Moore said in his release today, is low, and that's a good thing. But the warning sign for us is what's happened in Europe. So over the last year, they had a 40-fold increase in the rates of measles infections in Europe. It went from just under 1,000 in 2022 to over 40,000 cases in 2023. And that reflects how infectious and contagious this virus is. So by one estimate, 9 in 10 people who are exposed, if you're not vaccinated, will become infected.
There was some concern, of course, over the pandemic that people might have missed a vaccine or 2 during much of the challenging times that we had over the last few years. And we can ensure that Canadians are up to date on vaccines. Remember, measles is a 2-dose vaccine, and there are certainly catch-up campaigns in clinics in schools and in community centers and public health clinics around the country to ensure people are up to date on these vaccines, because this is completely preventable. Yes, we will import cases from time to time in Canada, but no, we should not have any sustained transmission in Canada, because we should have our vaccine rates well above 90%.
Both cases in the GTA were from children who traveled abroad, and we also are right around the corner from one of the largest travel seasons for many people, spring break / March break, which is why doctors are putting out this warning now. Send it back inside to the desk.
Eden Debeba live along Hospital Road. Thank you.